Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Wednesday, October 7th, and this is my daily briefing. First, I just want to let you know that I'm trying a different format today, so please forgive me if it's a little bit clunky. We've had 1,175 cumulative positive cases in Missoula County to date, with 43 new cases since yesterday. We've had 752 recoveries and 4 deaths. 4 Missoula County residents and 4 non-county residents are currently hospitalized in Missoula County. We now have 419 active COVID-19 cases, and we've currently identified almost 1,200 close contacts. Those active cases and their known close contacts remain in isolation and quarantine and are being supported as needed. The state of Montana is reporting 16,063 cumulative COVID cases, which is up 733 new cases from yesterday. That is a record number of cases being reported in one day in the state. There are now 5,352 active cases with 235 active hospitalizations across the state. And there have been 193 deaths related to COVID-19 statewide. The state website is showing Missoula County having 211 new cases overnight. Again, I just want to let everyone know that our local data is the correct data, as there is a lag in what the state is reporting due to the way that they collect that data from us. The 211 cases are really just the state getting caught up. The University of Montana has had 207 cumulative associated cases since the beginning of fall semester, which is up 15 since yesterday. And there are currently 101 active cases associated with the University of Montana. I know I've been asked to slow down a little bit when going through these briefings, especially when reporting the numbers. And I just wanted to let you know that while I can try to slow down when I can, I usually only have about 15 minutes to get the briefing prepared, recorded, and uploaded between meetings. I'll definitely do what I can to try and slow it down a bit when I actually have the luxury of time. So next I want to share my screen and show you some of our data. So if we look at this, this particular graph, this is showing new cases by the date that they are reported to us. And as you can see, we've had a pretty steady incline. The blue line represents the 7-day average of number of new cases being reported by day. This is showing our active COVID-19 cases in Missoula County in the past 60 days. This number is really important for us to watch here in Missoula County, because what this graph is telling us, or what the active cases is telling us, is what's actually happening in our county right now compared to looking back at cumulative cases from the beginning of March. So this graph is showing our route of transmission for current active cases right now. And as you can see, 62% of our active cases right now have been confirmed to be the transmission came from being a close contact to a confirmed case. About 34% have had an unknown source, which would mean that it is community spread. What we would like to see is this to hold steady, where we're having a much smaller amount of community spread than known contacts. So last week I talked a little bit about how when we see a spike in the 20 to 29-year-old age range, that within 5 to 14 days, we're going to start seeing a spike in older ages as well. And we are starting to see that shift now. About a week ago, this 35% number, the ages of 20 to 29, was about half of all of our active cases. And these numbers were much smaller. And so now what we're starting to see is that those numbers are starting to increase, particularly in those groups that are over 50. So the only other new information that we'll be sharing today is related to how the disease is spread. The CDC updated guidance earlier this week saying that COVID-19 can sometimes be spread by airborne transmission. Until now, they believe that transmission only occurred through droplets. The biggest difference between these two is that with airborne transmission, the virus can linger in the air for minutes to hours if it's under the right temperature, ventilation, and humidity levels. There is evidence that under certain conditions, people with COVID-19 seem to have infected other people who were more than 6 feet away. These transmissions occurred within enclosed spaces that had inadequate ventilation, and sometimes the infected person was breathing heavily, for example, while singing or exercising. Under these circumstances, scientists now believe that the amount of infectious smaller droplet and particles produced by the people with COVID-19 became concentrated enough to spread the virus to other people. The people who were infected were in the same space during the same time or shortly after the person with COVID-19 had left. Available data indicates that it is much more common for the virus that causes COVID-19 to spread through a close contact with a person who has COVID-19 rather than through airborne transmission. Even with this new information, the same precautions should be used. Physically distancing of at least 6 feet is most important. If you can keep more distance, that would be even more protective. Wearing face coverings, keeping your social circles very small, and hand washing all still apply. Be sure to stay home and get tested if you develop any symptoms of COVID-19. And again, you can call 258-INFO to schedule a free test through our Flynn Lane drive-through facility. Just a heads up that our call volume is always really high on Monday mornings and on Fridays. So if you call on those days, you may have longer hold times. So that's it for my briefing today. As always, you can subscribe on YouTube under my name, Cindy Farr. That's CINDYFARR. Click that notification bell so that you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can check out our new website at missoulainfo.com for lots of great, more easily navigatable information there. And you can call 258-INFO if you want to schedule a test, or if you are wanting just more information about resources that might be available to you, or you have general questions about COVID-19. So until tomorrow, everybody, stay healthy.